Hi, I'm Dr. Sonja Kinney. I work in the Department of OBGYN. I originally came from the Midwest. I was born outside of Chicago in Evanston. I then moved to California and was raised there in Palo Alto. I traveled across the country to New York City to medical school in Albert Einstein. Then I went to Salt Lake City for training in residency. They love to have babies in Utah, so it was a great residency training. I don't think I've ever not wanted to be a doctor. I know it's a double negative, but at 5-6 years of age, I think someone in the neighborhood fell down, and I immediately jumped all over, putting bandages on, and just felt that it was something where I like that hands-on approach. I like being able to get in there and help people, but I think a lot of I'm a surgeon, but I also really educate women about their own health. Obstetric patients it's an amazing time of their life. This life event, I had a patient last night saying, I know my marriage was really a big deal, but my delivery and the day of the birth of my child, that's going to even be a bigger day in my life. It is something where it's really an honor to be involved in that entire process. There's so many unanswered questions that we have just about how people get pregnant. There's so much of the social and medical that comes together when you're taking care of that OB patient. And then technically, it's a time where your body is somewhat out of control. We do so many things in medicine with medications and surgeries, and we think we have all the answers and can tell people exactly how it's going to go. There is something to be said about just the anticipation of waiting to kind of meet this new life and just helping the family through it. I chose the academic route because it gave me an opportunity to be part of the education process. I feel that it keeps me a little bit more in tune with new advances in terms of our different educational series. I'm seeing patients from as young as 12, 13 years of age all the way up into people in their 90s. I have a general OBGYN training, and so I'm there to do health maintenance screening, well woman exams, all the way through all types of problem visits, whether it be obstetric patients or gynecology patients. My specialty is really dealing with women who have abnormal pap smears. I'm kind of the go-to person in the department when it comes to how to counsel people, what are the most updated algorithms and treatments for women trying to prevent cervical cancer. But the one thing I'll tell you about when you come into my clinic is I want to meet you with your clothes on. I want to sit and talk with you, get to know you a little bit, be pretty focused on what we need to get accomplished, but I want to get to know you as a person as well.